Insulin bruises got you hiding your arms, or even worse, skipping your injections, because every bruise feels like you were doing something wrong. You hide your body from going to the swim, from going to the sauna, from changing clothes, even in a same gender changing room. I see this all the time. Some people even get tense before the needle touches their skin, always complaining about belly lumps, bruises, and discomfort. Some will even ask you, where else can I inject? And if you're on blood thinners, that makes it even worse because you are dealing with two injections on already stressed skin. Over time, it wears you down. But listen, you are not the problem here. Your technique might be. Let me show you 5 tippy toppy nursing level hacks to get your skin under control and bring your confidence back while still managing your health. Let's fix this together. Most people don't have a technique problem. What they have is a rotation problem. You can't keep going back to the same sport and expect your skin to behave. So here's what you do. 1. Injection site rotation. Divide your body into zones. First, your abdomen. This is your best area, but stay at least 5 centimeters away from your navel. 2. Your outer thighs. 3. Back of your upper arms. 4. Your sides, your love handles. Now, the rule is very simple here. Every injection should be at least 2 finger width away from the last one. And please, don't hit the exact same spot again and again. If you are not sure where your last injection was, use a washable marker for the first few days. I usually do this with patients all the time, especially patients complaining of these particular issues. Because those lumps people ignore, those hard rubbery areas under your skin from repeated injections in one spot, that's what we call lipohypertrophy. The problem is not just about how it looks, but the problem is insulin doesn't absorb properly there. Your sugar control becomes unpredictable. If you fix nothing else, fix this. Rotation is not optional, it's part of the treatment. 2. Your technique. And honestly, this is where most of the bruising actually comes from. Not the insulin, not your skin reacting to needles, but how you are injecting. Let me walk you through it, how it should actually feel. That's it. Simple. But most people don't do it like this. Kind of rush. They stab themselves. They pull it out too quickly. And that's when you start hitting that small blood vessels, moving the needle around your skin and ending up with bruises. So if you are bruising every single time, something in your technique is off. 3. Recycling needles. This one is simple, but a lot of people kind of ignore it. If you are reusing your needles, you are damaging your skin. After just one use, that needle is no longer perfectly smooth. It becomes slightly bent, slightly blunt, and instead of sliding in cleanly, it tears through your skin. That's where the pain comes from. That's where that bruising is coming from. If you are reusing your needles and wondering why your skin looks like that, now you know. You can get your needles prescribed. So there is really no reason to keep you reusing needles over and over again. If it hurts more than usual, if it feels rough going in, please change the needle. Don't push through it. Small habit, but it makes a big difference. Fresh needle every time you inject yourself. Your skin will thank you for it. 4. Cold pack. This one is also simple, but people kind of overdo it. Before your injection, you can lightly cool that area, nothing extreme, just a small cold pack, because this can help reduce your chances of hitting those tiny blood vessels. But after that injection, don't rub it. Don't massage it aggressively. Don't start pressing it like you are trying to fix something, because that's how you turn a small injection into a bigger bruise. If there's a tiny drop of blood on it, just apply a gentle pressure for a few seconds and leave it alone. Your skin heals better when you don't keep disturbing it. All right, so by now you've fixed your rotation, your technique, and you are using fresh needles. Now let's talk about what happens after the injections, because your skin still has to recover. And this is where people start trying everything from creams, gels, recommendations from friends. In some hospitals, when bruising happens, they usually use heparin sodium topical as aftercare. Just a thin layer over the area and nothing more, nothing aggressive. Some people also use things like Postopix, arnica, or diabetic repair creams. And honestly, while some people say it helps, others don't notice anything much. So use whatever feels right for your skin. But don't expect any cream to fix everything, because if your technique is off or you keep going back to the same spot, you will still bruise. That part doesn't change. Now, the second part people kind of forget is what's happening inside your body. Your skin heals from within. That's very sure. So, if your blood sugar is unstable or your nutrition is off, your skin will still struggle to recover, no matter what you apply on top of it. And this is where simple things matter. Things like vitamin C, zinc, getting enough protein, these all support your skin healing. You don't need to start buying everything you see online. You just make sure your body isn't lacking what it needs. Because at the end of the day, better support inside shows on your skin. All right, so what should you actually expect after all this? If you fix your rotation and your technique, most people notice a difference pretty quickly. Less bruising, less pain. Your skin starts to calm down quietly. Not perfect overnight, but significant improvement. If you are still bruising, don't just guess, check what's going on. First, your technique. Are you rushing? Are you moving the needle? Are you even giving it those few seconds before pulling out? Second, your sight. Are you really rotating, or are you going back and forth to the same comfortable spot without noticing? Some of you are on blood thinners. Some have thinner, more fragile skin. So yes, you might still bruise sometimes, but it shouldn't be every single time. If bruising keeps happening, go back to basics. Change your sight, slow down your technique. If you are getting those lumpy areas, avoid that spot for a while. Let it recover. If it's painful, look at your needle length and stop forcing it. If you are unsure, come back to this video and watch it all over again. Sometimes, just seeing it done properly changes practically everything. Know when to step back. And then, there are also other things you should not ignore. If you notice a hard lump getting bigger, a redness spreading, warmth or increasing pain, or nothing improving after a couple of weeks, that's not something to keep managing at home or something you should ignore. Go and see a doctor. Bottom line, if you are bruising every now and then, that can happen. But if it's constantly happening, something needs to change. And now you know actually where to start.